So I know I've thrown a lot out there. I'm going to stop now, I promise. And very much look forward to your comments and questions, and I hope that this is informative and understandable.
Thanks, Micky. Thanks, Cait. That was really interesting, a lot of data. So we had a couple questions come in through the chat box. So I'm going to ask those, and while you answer, I'm going to unmute people so they can ask additional questions if they want to out loud. So there's two questions came in together, and that is the availability of these apps is really great, but how vulnerable are EHR systems to hacking by opening the databases to these apps, which I think you were just speaking to, and how vulnerable are EHR systems to adverse effects on performance, either unintentional or malicious?
Yeah, those are both great questions. So the first one is, I think that they're very secure, and I put that in quotes because nothing is 100% secure. Obviously, things get hacked all of the time, but at least the security protocols and security technologies and policies that are being put in place for these things that are made available via these APIs all fall under the HIPAA security rule at the point of the API making the data available to that app. And that was all used, sort of modern encryption and modern, sort of security provisions. So I'm very comfortable that part of the security is very secure. The challenge that we have in this, in this ecosystem is that, let's say that a patient brings an app that is not secure and says, I want to access my data via that API, and my app, it meets your specification. It meets your, so you're required to make that data available to me, right? And that's what the rules say. The rules say that patients have a right of access, and the rules specify that no provider or vendor is allowed to prevent a patient from getting the information on the app that the patient chooses as long as it meets the technical specification of the API. Well, you have lots of bad actors out there who could easily meet the technical specification. They could get that data. They may not be secure either because they're not, since they're not good, it's a matter of, it's just sort of poor implementation, or because they're malicious. They actually have a backdoor that they're, leaking the data to something else. And right now, the rules wouldn't prevent that from happening, in the sense that, that a provider organization nor a vendor, an EHR vendor, is allowed to tell a patient, we're not going to send that data to you for that specific reason. So that's a challenge. But in terms of the security itself, up to the boundary of the app, the EHR making that available, I'm comfortable with with the security level there. The second question, I forget, what was it again, Amanda?
How vulnerable are EHR systems to adverse effects on performance, either unintentional or malicious?
Yeah. No, that's a great question. So what that gets at is, I think there's a general question of, well, gee, if you're going to have all of these apps coming in now, all of a sudden hitting all these EHRs, could that really affect performance? And the answer is yes. I mean, obviously, the answer is definitely yes. And I think it's not just with apps. As you start to see more and more interoperability, so we haven't, because we're talking here about patient-facing kinds of things, but with provider-to-provider interoperability, you have Commonwealth and Care Quality, which are provider-to-provider organizations that allow interoperability across providers. They're managing, tens of millions of transactions across these, and they're hitting the same systems, every year. So you've got this issue of now everyone is sort of, hitting all of these servers all at the same time. And so it's certainly a concern. I think the vendors are concerned about it. And they're starting to build up the infrastructure to say, well, we need to figure out how to manage that. And with some vendors, it's a little bit easier for them to think about how to do that because, like Athena Health, for example, everything is based on the cloud, right? So everything's based on the cloud. They sort of have a natural, sort of way that they can continue to grow that. They do have to be diligent about it, but they can grow that in the cloud in a way that's, that's relatively straightforward. More challenging are for vendors like Epic, eClinicalWorks, some others, where they still have a lot of customers who have on-premise infrastructure. And so you can imagine that, that's a conversation that Epic has with every one of their customers is that, hey, as we're opening up these apps, we need to be very cognizant and diligent about how we manage the load balancing on your systems because you own those systems. It's not Epic owning them. Those individual provider organizations own them. Now, I think Epic is thinking about how they can create some kind of cloud-hosted infrastructure that might provide some load balancing and might provide some intermediary services to reduce that. But, that's definitely a concern for sure.
Awesome. So there's a couple of other questions that came in through the chat box. After Apple makes it possible for developers to connect with the health records with the permission from individuals, will those same individuals, innovative patients, be able to create their own digital tools? And Liz is talking about an example of Dana Lewis, who created her own artificial pancreas system.
Yep. Yeah, so I mean, conceptually, the answer to that is yes. In the same way that if you wanted to create your own app now to access information on your iPhone, you can do that today, right? There's nothing stopping you from doing that. All the specifications are available on the Apple website. There's no secret about what those technical specifications are. You would have to register the app and agree to Apple's terms and conditions and, payments and all of the things that they require of any application that's on their app store. But if you're willing to do all of that, then you absolutely can write your own app and make it available on, and register it with Apple and do it that way. There are people who jailbreak their phones also and, have apps that access the information in a way that goes around Apple's, sort of system. I'm not saying I recommend that, but there's nothing preventing you literally from doing that as well.
There's another one that came in through the chat box, and that is, if a health system uses one app from a vendor for its own purpose with a BAA with that vendor, does that BAA render that vendor a business associate for a FHIR app, a different app used by that health system's patients?
So I think now I should have cautioned at the very beginning of this. I'm not a lawyer. I'm happy to speak to this, so take this, take this all under the, with the knowledge that, you before implementing anything, you definitely should consult your lawyer on this. But I do spend a lot of time, sort of working through this and working with lawyers on this. So in answer to your specific question, I think the answer is yes, if let's say you've got a health system, let's say it's Partners or Beth Israel or whoever it is, Mayo Clinic, and they have an app that they want to make available to their patients exclusively, and they work with that vendor and they say, you are a business associate of ours. We want you to be under that HIPAA protection, and you have to meet all the HIPAA security rules, and you are one of our business associates, then yes, absolutely. The protection of HIPAA would extend to that app then at that point.
Okay.
But, companies like Apple, for example, will explicitly say, we are not going to do that. Apple says, we're a technology company. We are not going to sign BAAs with provider organizations because this is being made available for patients to use their right of access to access their own information. And we don't believe that we need to be a business associate because we're giving patients the tools to manage their own information.
Micky, I have a question that this is Cait, that I wonder if other people on the phone are also wondering, and that's, given where we are now, how far down the road do you think this world of sort of readily available FHIR-based apps that allow patients to do all kinds of cool things with their data? And it seems to me there's a lot of work between where we are now and getting to there. Am I right about that?
I think you're right in terms of, there's a lot of work to do. On the other hand, I think that it's in the patient, sort of the patient access through FHIR-based apps is, as opposed to, let's say, provider to provider, exchange via FHIR-based apps. I think that the patient channel is going to move much, much faster. For a variety of reasons. One is that, that the federal government is putting its weight behind saying you absolutely have to allow patients to exercise their right of access to this information through these new tools, and we're going to be, sort of pushing everyone to do that. And, you've got Apple now, the consummate consumer-facing product that is now, put a stake in the ground saying that they believe this is really important, and they're going to be leaning very heavily into saying, now, how do we make this valuable in terms of developing that app, sort of that app ecosystem. And, and with that announcement that, that you can now start today to develop against it, I think we're actually going to start to see probably over the next, so you asked the question of when, and I hate making predictions like that, but I think that like 3 years from now, we're going to look back and feel like, whoa, there are a lot of apps available now that, that we might not have really imagined a little while ago. So I think that's going to happen, pretty darn fast because everyone's incentives are aligned that way. Provider to provider is a little bit harder because there's already existing ways to do it, and not that many people, the fewer people are kind of interested in that right now for a variety of reasons.
Okay. Thank you.
Awesome. Thanks so much, Micky.
All right. Thanks, everyone. This was
Yeah,
great, and I learned a lot. Thank you, Micky.
Thank you.